Hello and welcome to the Complementary and Alternative Medicine Podcast, a division of Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us. We're going to be speaking with Dr. Teresa Cody, joining us as author of the book, You Healing You, The Healing Power of Platelet Rich Plasma. Welcome, Dr. Cody.
Thank you. Thank you for having me.
Well, I appreciate you taking the time this morning. Give our listeners a bit of your professional background. Tell us a little bit about yourself and your area of expertise, if you would.
Oh, I'd love to. I am a dentist, fell into platelet-rich plasma use for total wellness. It's interesting that platelet-rich plasma has been used in dentistry for 30 years. We use it for bone grafting. But we put the bone graft in, use platelet-rich plasma, and then don't disturb it for 3 months. So I didn't really know how effective it was for the rest of the body. My crazy hairdresser is the one that got me into this mess. No, it's fantastic. She had a very hurt hand, and she had gotten a steroid injection after 40 years of doing hairdressing, cutting hair. She had trigger fingers and she could not make a fist. And she got a steroid injection and felt better for about 4 months. And then, all the pain and injury came back. And she's like, I think I'm going to get another steroid injection. And I was sitting in her chair. She's cutting my hair. And I said, you can't do that because you really can only get 3 steroid injections in one area over really a lifetime. So I said, why don't you come in and let's try PRP? And I don't even know where that came from. I don't know why I said it. And so she came into my dental office and we injected her hand in the hurt areas. And she sent me pictures the next day. She could actually touch her index finger to her thumb.
Wow.
And I was like, oh, what is going on? And then the next day, so I injected her Monday afternoon. Wednesday afternoon, she sent me a picture. She was making a fist. And I went, oh, I got to figure out what this is. So that was the beginning of my journey into studying and looking into the plasma that, we all have it. And we're using your plasma, putting it back in your body in a concentrated manner.
What are platelets in simple terms?
Platelets are white blood cells. So what we're using is platelets and the plasma. That is, so we take a tube of blood, a test tube, and put it in a centrifuge and spin it. And the red blood cells are heavy, so they fall to the bottom, and the plasma it separates and it sits on top. And it's a gold color. And we take that off and inject it back into, we do knees. I have a nurse and a MD on staff, and they inject knees and plantar fasciitis and hurt shoulders and hips. Anywhere that's hurt, we have probably about 99% success of recovery. It's a miracle.
Yeah. Now, I did hear you mention that you take a test tube of blood, a vial of blood, put it in a centrifuge, and the red blood cells separate from the platelets or the plasma, right?
Right.
Are the platelets created in the blood? Are they created in bone marrow? Where do they originate in the body to get into the bloodstream?
In the bone marrow.
Ah, okay.
So that's where you're making your red blood cells, your white blood cells, and we feel really very confident because we are using your healing factors to heal you. If you skin your knee, the body sends the plasma and the platelets to clot the area, to make the scab. And then in the plasma is, at this point in time, we've identified 15 growth factors. but I'm sure there's probably more. So there are growth factors that attract stem cells. And then there's a growth factor that tells the stem cells what to become. Because you look down at your knee 10 days later and you have new skin, and you have new blood vessels, and you have new collagen, and everything's healed up. Well, it's the platelets and the plasma that do all of that.
Now, as far as these platelets are concerned, you say you've been using it in dentistry for 30 years plus. You say that the platelets' main function is to clot blood and to heal wounds. Was the uses for platelets that we have now, was this an accidental discovery as far as dentistry is concerned? And then you decided, oh, we can use this in other areas too?
I remember the oral surgeon in our building showing us PRP, or platelet rich plasma, early on. It was kind of accidental, I think, in dentistry. What happened is the jawbone doesn't really have much blood flow. If we put a bone graft in and didn't use it, it didn't take very well. So if you don't have bone, you cannot get an implant. There's nothing to put it in. But, it's used in equine medicine all the time, which is horses. I was telling my neighbor I'm going to open a wellness center, and I was telling her we're using platelet rich plasma. She said, oh, I know all about it. She has 3 horses. That is their first line of treatment for horses because it helps to heal up ligaments and tendons. And they don't heal very well. I mean, it's also used in professional athletes quite often to try to get back on the field sooner, right, to heal up. So I just think that it's been missed in our medicine. I talked to a OR nurse a few months ago, and she told me, oh, yeah, we used to use it in the operating room, but then insurance decided not to pay for it, so they don't use it anymore. They don't even offer it.
I am familiar with plasma donations, blood donations. I know that there are 2 different things. When someone goes and donates plasma at a center in town or whatever, is all plasma platelet rich? Are some people's plasma more rich in platelets than others? And with that question, what about anemia? How does it affect platelets?
Younger, healthier people probably have more, right? And it's kind of a big deal to donate your platelets, and they use platelets to stop like hemorrhaging, bleeding, because its first job is to clot, okay? But it just depends on the anemia question. It would depend on what causes the anemia, right? If you had a B12 deficiency, or you had a low red blood cell count, or we have found everyone, we've treated like diabetic wounds, and we have seen everyone get better. A lot of people with diabetes are not very healthy. But the plasma and the platelets, they have a job to do, and they do it. We also do cosmetic. We do a thing called a vampire facial.
A vampire facial. Well, I'm ready to hear about that. That's for sure.
It is the use of PRP, and we inject it back into the face, and it heals up the skin and gives you more collagen and makes the skin beautiful is what it does. It makes your skin glow.
Let's say that I get my skint knee and my platelets are naturally healing my knee over a course of a few days. If I were to have platelet-rich plasma applied to that wound, is that wound going to heal much faster, much stronger? And how would that therapy be administered? Not necessarily in a skint knee, but in any type of wound scenario.
Well, we inject it in to the area. And I would say that like with a skin knee, I'm not sure that it would heal stronger, but faster. With tendons and ligaments, the problem is they don't have a lot of blood flow to them. So they tend to heal very slowly. And so when we concentrate the healing factors in the area, they seem to be able to heal faster. It kind of depends on the injury. If you need surgery, like you've completely torn a ligament, then you need surgery, right?
Mm-hmm.
But we've also treated patients who have had surgery and then treated them post-operatively, and they've healed very well.
In the circumstance where an elderly person has sustained an injury, do these platelets act as brand new, healthy platelets in this particular individual, or do the platelets that are within their body that are being produced at their age and that quality of platelet, do they replace them? Do they interact with them? Do they enhance a patient's own platelet production once therapy is introduced?
Well, we're not sure. You know, it's the beginning of the research. 5 years ago, I know that, maybe 7 years ago now, that we had found 5 growth factors. Now we're up to 15 growth factors. So it's all fairly new discoveries, right? That because people thought that stem cells would be the way to go, which there's nothing wrong with stem cells. But if you don't have plasma, the stem cells don't know what to do. So it's like the plasma are the directors. Now, as we age, we kind of lose things, but it seems like it doesn't matter how old the patient is. They heal up. Doesn't seem to matter. Now, that's just from clinical practice. That's not doing research, but we've had all age of patients. You know, people who have had injuries for a long time, it can take a good 12 weeks to heal up. It's not like it's just a magic potion that you put in and you instantly heal. But like I said, we've had 99% success rate of people healing, right? Maybe not 100% recovery. Sometimes we have to treat it more than once, but always a percentage getting better, which is very exciting.
Platelet production in the body. Are there instances where a person's therapy unrelated to the injury can affect their platelet production in the bone marrow, in the spleen? For instance, if you're on medications.
Well, I do have a number of patients who take medications that do lower their immune system and do affect. I'm not sure how the production of platelets is affected. We've never seen anyone that didn't have them. I mean, you got them. When we spin them out, we can see them. Platelets are white. So we see a layer, and it's called the Buffy coat. So I have never seen that, so I don't know. But, you know, a lot of Americans are on medications, that's for sure.
I do understand that for people that are dealing with some types of chemotherapy, there are drugs that accelerate bone marrow production for that purpose, to enhance the immune system and the resistance to the chemo.
Right.
Are there certain factors where such components could be introduced so that a person's platelet count could be elevated for their benefit or the benefit of the recipient of those platelets, if it's a donor situation?
So there are medications that increase, because when your platelet count gets very low, you do not heal. So you're right. With the chemotherapy, there's worry that you're not making enough to heal anything and to fight off diseases. Well, you know, during this whole crazy coronavirus, there were donors who donated their plasma for antibodies. So there was a whole program of people who donated to enhance antibodies and immune reaction and immune therapy. We ended up with monoclonal antibodies, you know, as a drug therapy, but yes, people do donate plasma. We just stick to, in our clinic situation, we stick to you healing you. So we don't test and make sure we don't share plasma.
Speaking of...
No sharing allowed.
No sharing. Speaking of you healing you, your book, You Healing You, The Miracle of Platelet Rich Plasma, what was it that prompted you to write this book?
Well, I realized that this knowledge is available, but not very widely known. So I really wanted to share what I found out and what I've discovered in the last few years. And I don't know what made me write a book. I heard a prolific writer, somebody asked him how he wrote so much, and he said, well, he wrote 200 crappy words a day. And I thought, well, I can write that. I can write 200 really bad words a day. And then I just started writing, and I was just amazed at everything that we've seen. And, you know, I've been in healthcare. I have a dental office, and I've been in dentistry for 30 years. And this was the most miraculous thing I've ever seen work for people. You know, tell people that this is made by God, so this works.
It works.
This is not
Absolutely.
made by man. I've seen so many things heal up that weren't healing, that I just started taking notes, and I started writing down the stories of the people who came in.
Give us a website where we can learn more about Platelet Rich Plasma and pick up a copy of your book as well, You Healing You, The Miracle of Platelet Rich Plasma.
You can get a copy of the book on Amazon, and my website is cncwellness.com, which is the letter C, the word AND, the letter C, wellness.com. My dental office, CNC Dental.
Okay.
So we're right next door. It's my building. So, because my husband and I are both dentists. So, yeah, we're here right outside of Houston. That's where we are.
Well, is there anything briefly that you'd like to add that you think would be beneficial for our listeners?
Well, just this is the most awesome kind of experiment I've seen in my lifetime. That this is so safe, so easy. You have it inside of you, and you didn't know that it was doing such great things for you, healing you everywhere. And so, you know, it's not a very difficult thing to do. Centrifuges have been around for a long time, and it's just been so fun to see people be able to heal what they couldn't heal before.
Well, Doctor, I've had a pleasure speaking with you this morning. I appreciate you joining us here on the podcast, and hopefully we'll speak again in the future. It's been a pleasure.
Thank you very much for having me. I really had a great time. Thank you.
You've been listening to Health Professional Radio's Complementary and Alternative Medicine podcast. Audio copies of this program are available at hpr.fm and at complementary and alternative medicine.health.